Jo Chidi has battled weight for most of her life.
When you're heavy as a woman, it's depressing. It affects you emotionally.
This is what Chidi looked like before she stopped eating high-fat foods, began exercising, and lost 18 kilograms. New research shows that obesity costs the United States $147 billion a year, or $1,400 a year more for an obese person than for someone of normal weight. That's what a study funded by the U.S. Centers for Disease Control says. What's driving these costs are prescription drugs for obesity-related diseases such as diabetes. Health economist Eric Finkelstein is the study's lead author.
The only way to show real savings in health expenditures in the future is through efforts to reduce the prevalence of obesity and related health conditions.
Finkelstein says what's alarming is not just the number of Americans who have tipped the scales, but the pace at which they're doing it. Finkelstein says obesity affects all racial and ethnic groups, the rich and the poor, and most dramatically, America's children. 1 in every 5 children is obese or overweight. With food everywhere designed to tempt the taste buds, Dr. Thomas Frieden, the director of the CDC, says weight gain is hard to prevent.
If you go with the flow in America, you will end up overweight or obese. This is not a result of a change in our genes. What has changed is our environment.
Dr. Frieden says Americans consume 250 more calories per day than they did 20 years ago. He says the rising obesity rate is the single greatest contributor to a national epidemic of diabetes. To help combat the obesity crisis, public health experts discuss the need to change people's behavior by promoting exercise and good nutrition. Federal stimulus money would go to local communities to encourage grocery stores to sell more fresh produce in poorer neighborhoods and to get more fruits and vegetables into school lunches. Finkelstein says because high-calorie, low-nutrient foods cost less than fruits and vegetables, it's harder to stay on a healthy diet. And as people use more technology, they tend to be more sedentary. As for Jo Chidi, she's excited about the changes she has made.
It feels great. I feel like a different person.
If only public health officials could bottle that enthusiasm and spoon-feed it to others. Carol Pearson, VOA News.